Hi, I'm Jerry Gelbart, and I hope you find this 45-minute video stimulating. All of us grow up with a simulator in our brain. It develops and organizes as a network during childhood, becoming an automatic program in our brain growing up. The ground rules, the operating system or beliefs are very rudimentary, black or white. A person is either good or bad, strong or weak, normal or not. You may be familiar with the simulator or network as the voice in your head. Yours might be saying, "I don't have a voice in my head," or "Who is this guy?" That's the one. This voice is very defensive, negative, and judgmental. It is focused on our weaknesses and failings from the past and projects a future based on this past. While most of us can shrug off the voice and disengage from it when we need to focus on our tasks, those who suffer from depression or anxiety have a switch that is stuck. They can't change the channel. They're swallowed up by these disparaging thoughts, and every day becomes a living nightmare. The voices I'm referring to are experienced as coming from inside our head, as opposed to auditory hallucinations, which are experienced as coming from the outside. There can be a lot of confusion about that. While we all normally have a voice or voices in our head, the consequences can range from insecurity to anxiety to panic attacks to psychosis. Now, through recent brain imaging techniques, we can see the voice in our head. It's called our default neural network. Not only that, but we can define alternative brain networks such as executive and salience networks. These networks are like streams of thinking. Executive network helps people function in the present to make plans and sound decisions. Default neural network tells us how weak or bad we are. These are other names for the default neural network. Maybe you have some of your own. It's so exciting to me, both as psychopharmacologist and psychotherapist, that we can now talk about these networks in the brain. They're like streams of thinking. Mindfulness practice and other types of meditation teach people how to break out of the streams. Imaging studies are also helping to elucidate brain areas and pathways involved in functions relevant to depression and anxiety. These include areas as listed here: cognitive rumination, reward satisfaction, mood and energy level, and these 9 areas that we'll hear over and over again in this presentation: body regulation, attuned communication, emotional balance, response flexibility, empathy, insight, fear modulation, intuition, and morality. This is where the brain and the mind come together. How can we change these pathways? How can we create positive effects in these areas? How do we liberate the depressed and anxious patients from the enslavement of their default neural network? Can we train and strengthen healthy pathways? And can we enhance and further develop brain pathways that will help patients function better and feel happier? We bring in the concept of brain plasticity. Neurogenesis continues throughout life. Brain cell death and brain cell growth are important concepts to keep in mind and to pass on to your depressed and anxious patients. Later, I'll go through strategies to help patients to change behaviors. The prime strategy I recommend is to educate them about scary data showing how depression kills brain cells, plus encouraging data that shows neuroprotection from antidepressants and quick treatment, as well as a potential growth of new cells and pathways through exercise and other lifestyle changes. Newer therapies, such as cognitive behavioral and dialectical behavior therapies, teach the patient to challenge the beliefs of their default neural network. Some cognitive therapies have been shown in imaging studies to alter brain function, such as Baxter et al. With OCD at UCLA. Mindfulness practice helps to observe, isolate, and disengage from the simulator and the judging, strengthening the switch or channel changer. New coping skills such as emotion regulation and relaxation methods can be taught. Adding behavior, lifestyle changes such as exercise, healthy nutrition, yoga, meditation, healthy relationships, and spirituality all enhance our treatment both by boosting confidence and improving brain biology. To move our mentally ill patients forward requires redefining some concepts. Let's start with what is a normal person. At the heart of anxiety and depression is the feeling of not being normal, being different. Their default neural network tells them that because of this, they're sentenced to a life of exclusion and being alone. This black or white judging of the self causes intense shame, fears of rejection, and the belief that one's true self is unacceptable to, quote, normal people. Being mentally ill is a scary concept because it is almost synonymous with not being normal. The definition of stigma is social disapproval or unacceptability. Stigmatization of people with mental illness is extremely damaging and unnecessary. It comes from fear and irrational thinking. Stigmatization is both a consequence of mental illness as well as a cause. As a psychiatrist who does psychotherapy in addition to prescribing medications, I understand the impact of not being normal. Most people are all too familiar with biases against those with mental illness. However, many are not aware of how much the question of am I normal contributes to the cause of the illness itself. This language comes from our default neural networks, which are all black and white. The concept of being normal is very irrational, as there is no such thing. It makes no sense. We all have something wrong with us. We all have biological, psychological, social, and spiritual strengths and weaknesses. There are ways we're like others and ways we're different. If we have a problem with our pancreas, diabetes, or cardiovascular system, hypertension, or our brain, depression, we're all normal. Toxic judging in our society is irrational and responsible for a great deal of suffering. This involves some people deciding that being one way is better than being another way, that one person can be more okay or valuable or more worthy than another, that if someone has a defect, they're less than. It causes us to be defensive and to hide parts of ourselves we believe are flawed, especially psychological flaws. With the new discussions about guns and mental illness, this comes up again. Obviously, many of the tragic shootings have involved mentally ill people. I think having a registry for dangerously mentally ill makes sense. However, should anyone who sees a therapist for anxiety, adjustment disorder, or less serious illnesses be reported or put in the same group and thereby discouraged from seeking treatment? Since we all have weaknesses, flaws, or defects, many of which we're not aware of, then to not have a defect would be abnormal. We use guidelines to diagnose whether someone has a mental illness or not. This doesn't mean that those who see a therapist or take medications are broken or not normal, any more than it means that those who are not in treatment are normal. Everyone is somewhere along a spectrum from illness to health to wellness. We all treat patients and clients, normal people who are ill. We can move them from illness to health and on to wellness. Everyone is somewhere along a spectrum from illness to health to wellness. I propose a campaign to fight for radical destigmatization for everyone, starting with people with brain illnesses. We must challenge society's definition of normal and help people with mental illnesses see that they belong as well. I would acknowledge that defining the recent shooters as normal stretches the definition. What is illness, health, and what is wellness? Illness is easy to define. Something is wrong with the body. There's a problem or symptoms. Health is the absence of illness. Wellness is an active process involving behavior and lifestyle changes that improve and maintain physical and emotional health. Here's an example. Illness is when a patient has symptoms of depression, such as feeling hopeless, helpless, or worthless. Health is when they don't have symptoms, but that doesn't mean they're well. They're just waiting for the next round of illness. Consider this table. The concept of wellness is important for patients and clients because developing their routines will move them from illness to health and on to wellness. It's synonymous with relapse prevention. It will help them function at maximal effectiveness, and they'll enjoy their lives much, much more. Wellness is an active process involving behavior and lifestyle changes that improve and maintain physical and emotional health. It's not something you stop doing when you feel better. If a patient recovers from an episode of depression, they might consider themselves healthy. However, they're not very far from illness. If they slip, they'll start to see symptoms return. By that time, it's much harder to pull back to health. If they're practicing wellness and start to slip, they won't see symptoms. Instead, they'll see themselves slipping from their routines, such as their social time, creative time, or meditation time, and they can pull back to wellness easily by resuming their routines. You've heard me mention the biopsychosocial spiritual model. It's very much related to integrative medicine and to wellness. Teach your clients well. All human beings have needs. We understand that a car won't go unless we put gas and sometimes oil and other maintenance into it. It's similar with people, just more complicated. Most people don't prioritize self-care. Changing that is part of our job. We want to guide them to look at their strengths and weaknesses in each area and learn the skills they need. The model I was taught was that the patient is broken and needs to be fixed. That's called treatment or therapy. That model reinforces that the patient is defective. Whether we're treating a problem, i.e. depression, or simply helping our patient be as effective and happy as possible, the goal is development of healthy routines and a balance between self-care and productivity. In order to establish these routines, clients or patients need skills training in some areas. We won't be teaching all the skills ourselves. For example, many people need a nutritionist to learn healthy eating, or mindfulness class to learn mindfulness skills, or a therapy group to learn relationship skills. For now, just a quick overview of the routines in the model. Later, we'll go over the skills. These tables are designed to assist the patient to review strengths and weaknesses in each area and to begin setting goals. Biological areas include nutrition, exercise, outdoor recreation, body, mind, and sleep. Basic medical care and treatments for whatever illnesses they may have is also an important skill. We need routines that will support these goals. For example, mindfulness practice in everyday life. Activities that are self-soothing, challenging, selfless, loving. Necessary skills might include emotional skills such as sorting out feelings, distress tolerance, crisis management, emotion regulation, and developing a healthy outlook. Cognitive skills may include identifying cognitive distortions, neutralizing distortions, challenging your own belief system and assumptions. And behavior change skills can include learning how to focus, prioritize, plan, manage time, handle motivation and energy levels, and dealing with obstacles. It's important to help the patient develop routines that will help them feel like they fit in with the community, that they can work on circles of relationships, such as people who are close as well as people who may not be so close, and dealing with any dysfunction in the family and learning how to be closer to those that are important to them. They may need to learn skills in setting boundaries or being assertive, or actually how to relate or connect with people, how to communicate. In the area of spirituality, there's some important terms to understand. First of all, what is spirituality? Well, it has to do with the connection to a larger context of meaning in life, versus religion, that is a more structured form that spirituality may take within given traditions. Worldview is about a person's own interpretations of life's basic questions and how we each translate the world and our existence. The patient may need guidance learning awareness, learning how to resolve conflicts that developed during their religious upbringing, and deciding their own morals and values and worldview, and also to learn how to practice and experience spirituality. Working on spirituality helps the patient face their beliefs from growing up and challenge them, formulate new healthy beliefs as an adult. Usually when they do that, part of that usually goes to the realization of taking care of their biopsychosocial spiritual needs as a priority. This work on spirituality has a great deal of psychological implications. Examples of spiritual routines include spiritual reading, classes, inquiry, spiritual contemplation, nature walks, joining with others, or giving to or helping other people. The spheres are interrelated, and improving one area leads to improvements in other areas. First, we'll look at healthy brain anatomy. Remember, the reptilian brain is basic body functions, heartbeat, breathing. The limbic brain is about emotions and impulses, and the neocortex is the thinking part. We enter into a partnership with the thinking part of their brain. We'll work together to achieve goals such as having more control over their impulses, their behaviors, their relationships, their health, and their happiness. This work is top-down rather than the bottom-up effects of medications. Both approaches have their roles. First, left brain versus right brain. Left is the 4 L's. Right is nonverbal. The right side mediates uncomfortable emotions and is associated with withdrawal, while the left side mediates positive emotions and is associated with approach. A lot of our focus will be on the middle prefrontal cortex, what it does and how to strengthen it. Daniel Siegel, MD, has identified 9 important roles for this area. They are body regulation, attuned communication, emotional balance, response flexibility, empathy, insight, fear modulation, intuition, and morality. If you've heard of dialectical behavior therapy, this is basically the development of our wise mind, which we'll signify with this picture. The 9 functions of the middle prefrontal cortex have also been shown to be important for child raising and development of secure parent-child relationships. And also, as a therapist, these are many of the goals of psychotherapy and what we consider development of healthy ego. While each area I'll show has multiple functions, the descriptions will highlight what's relevant for depression. It's not important to memorize the specifics. We'll start a whirlwind tour of the middle prefrontal cortex and the associated areas that are important for our discussion. As we go through each area, think about how problems with this could contribute to someone being depressed and dysfunctional, and how we might go about strengthening the functions. At the bottom of each page, you'll see abbreviations that may help you remember if you're so inclined. The orbital frontal cortex is important for attention and decision-making. The dorsolateral area is important for planning and at paying attention to external processes. Did you ever obsess or ruminate? When you ruminate, obsess over and over about negative things, your right ventrolateral prefrontal cortex is hyperactive. This is a very common problem in many of our patients. What skills do you think might address this? The ventral medial area is important to what's going on inside. Self-referential processing, everything that's about me. This is the part of the brain that projects the movies of our past and the simulations of our future based on those movies. The home of the default neural network. This area is heavily integrated with the limbic system and adds personal meaning, emotional charges to everything that's going on. Hopefully, our dorsal medial prefrontal cortex will increase in activity when we want to focus on a task. The anterior cingulate area is important for directed attention and shifting gears in the brain. The cingulate is also important to integrate thoughts and feelings. And now back to the default neural network. The default neural network is most active when the brain is at rest or in social situations. It's overactive in anxiety and depression. This is the voice in our head. This is the part that says everything is good or bad. It's also the home of our negative self-image and our insecurities. In Buddhism, that's the Shenpa. The default neural network is also the home of our cognitive distortions. Cognitive behavior therapy teaches methods to neutralize those, and mindfulness helps to decouple or disconnect from the default neural network altogether. This is the simulator versus the executive network or the cognitive control network. We might also look at being in the stream of our executive network or cognitive control network as being in the cockpit or the driver's seat of our life, rather than sitting in the simulator watching those movies telling us how bad we are. Other networks are the affective network and salience networks, and we're sure to find more in the future. We think there's a switch or a gate that helps to move between one network in the brain and another, and it may be located in the dorsal nexus area. That switch may be defective or sticky in depression. Mindfulness practice teaches how to fix the switch. The insula is important for being able to read our body states such as hunger. It's also important for recognition of gut feelings and consideration of moral intuition. This is an area of self-awareness and looking inward. The thalamus is important as a relay station for sensory information. And now the limbic system. The hippocampus is important for memory and threat detection. The amygdala is the home of the fear switch, and this is where emotional charges are added to what's going on. The hypothalamus is important for primal drives. The pituitary is the master gland. The caudate is the anxiety center of the brain, and that's where we're always predicting the worst. The nucleus accumbens mediates pleasure and is also involved in addiction. The deep limbic system is important for drives, motivation, and mood regulation. The parietal lobe is another area of the brain that is relevant for our discussion. It's important for spatial processing and also personal ownership. You can remember that in terms of personal distinctness. The cerebellum, while important for motor function and balance, is also important for decision making. Most of this discussion will not be about brain chemistry, such as serotonin and norepinephrine. You've heard plenty about that. We'll be skipping most of that. However, there are a couple of important chemical features we should mention. It's important to know about brain-derived neurotrophic factor. This is a fertilizer in the brain for new cell growth, and it's important for neuroplasticity. When the brain is depressed, there's a deficiency of this factor, and there's a deficiency of new cell growth. There are other brain processes that are important as well that we won't get into here. And now we turn to what's happening in the depressed brain. The prefrontal lobe shrinks. That starts to cause problems with attention and executive functioning. Decreased blood flow to the ventral medial prefrontal cortex and the dorsal anterior cingulate are going to cause problems with attention and executive functioning. The hippocampus actually atrophies with depression. That creates problems with memory. The amygdala also atrophies, which causes problems in the fear switch. It becomes hypersensitive and difficult to turn off. What happens physiologically in the depressed brain? The hyperactivity of the limbic system and underactivity of the frontal lobes creates situations in which emotions predominate. The individual can't turn off their emotional systems once they're activated. Negative memories from the past and negative simulations of the future are running independently from what's going on externally. There's a lack of awareness and lack of skills to change. The increased activity in the deep limbic system causes more anger and irritability from the left side of the brain and more inward-directed sadness on the right. What are the consequences of each of these? Well, there's less space in the brain for thinking. This is like the RAM, or short-term processing memory in a computer. There's intolerance and avoidance of emotional pain and emotional dysregulation. And there are abnormalities in cortisol secretion, which cause chaos for brain and body. This includes abnormal stress response, immune response, insomnia, and fatigue. I've pulled together these impairments into clusters that we can then work with clinically. First of all, the cluster I call executive functioning. This is the business office, which takes care of moment-to-moment decisions necessary for functioning and reaching goals. Attention is impaired. In depression, the past, present, and future are all one. They're stuck in the part of their brain that runs the movies of their past over and over, as well as simulations of their future based on their past. This is a cluster. Functioning. You can see that it includes problems with body regulation, attuned communication, all of those 9 features from Dr. Siegel. On the right column, it shows evidence from research about how mindfulness can help these dysfunctions. The cluster of executive functioning includes Dr. Siegel's 9 features, plus the skill of differentiating between past, present, and future, and the skill of attention. That default neural network activity keeps them wrapped up in themselves. They have trouble tuning into others, putting themselves in other people's shoes, and not twisting things to mean something about them. That cluster includes attuned communication and empathy. Mindfulness practice has been shown to decrease activity in the parietal cortex that defines our bodily boundaries and helps us to feel less alone. It also can train our brain to feel compassion for self and others. The next cluster is self-referential processing, consciousness of internal states, and that includes learning attuned communication, intuition, morality, and awareness of body states. They can be so wrapped up in the movies, simulations, and judging of their default neural network that they're not attending to what's actually happening in their body or other parts of their mind. This can include listening to their own intuition or morality, or monitoring or modifying their emotions, impulses, or energy states. Mindfulness has been shown to actually enlarge areas of the right insula, which is an important area for looking inward. Impulse control is another cluster and involves these skills and the associated areas of the brain. Next cluster is emotional response, which includes fear modulation, emotional balance, and being too much on the right side of your brain. The right column shows how mindfulness has been effective in helping these skills. Next cluster area is reward and satisfaction. We can understand how this is not working properly with depression. Next cluster is mood and energy levels. Cognitive rumination. That hyperactive ventrolateral PFC can be quieted. The last 2 clusters are somewhat for research purposes. They include brain cell death and network switching, and those are for future use. Next, how do we address the pathology? And now a brief detour about medications. Medications work biologically on the brain, basically bottom up, rather than the top-down effects of cognitive changes, and lifestyle changes work both from the top down as well as from the bottom up in terms of actually creating biological changes in the brain. Medications have been shown in research to increase the metabolism in the prefrontal cortex. They've also been shown to decrease the metabolism in the right ventrolateral prefrontal cortex. What would that do? Remember, that's the part of the brain that's responsible for cognitive rumination. And studies have shown that when the metabolism in that area decreases, people's depression improves. This is a summary of some of the studies on mindfulness and the brain. After that, we'll go into other skills. Mindfulness has been shown to shift the brain towards the left. Mindfulness practice breaks the brain out of enslavement to the automatic thinking and processes of the default neural network. A calming effect is achieved because of the strengthening of the connections between the medial prefrontal cortex and the insula. One way that I like to summarize it for patients is to explain that mindfulness practice will help slow down time for processing what's going on internally and externally, and making sure you're being objective and not judgmental. I think the effects of mindfulness and meditation on the parietal cortex are very interesting. Mindfulness has been shown to have direct as well as indirect effects on the brain. The top-down effects of mindfulness, cognitive therapy, emotion regulation, etc., are very helpful, but for some people, healing may include medication, short, medium, or long-term, to help heal deeper brain structures. We don't want to avoid putting somebody on medication in order to treat their depression as early as possible, adding the psychotherapy and the skills training, and then eventually aiming to reduce or hopefully eliminate medication over time. Mindfulness has also been shown to reduce resting amygdala activity, and it causes over time an enlargement of the right insula, which is an area of the brain responsible for looking inward. We come back to our Daniel Siegel factors. As you learn mindfulness, you become better and better at self-monitoring. When you feel too racy, stimulated, or agitated, you can settle yourself down. If you're lacking energy, motivation, or drive, and you need it, you can turn it on. You learn to tune in to others' thinking, feelings, and intentions, and coordinate your mind with theirs. It helps with connecting and closeness, and it will also come back to you. Emotional balance means that you learn how to adjust your emotional thermostat. Too much emotion, we become dysregulated and confused. With too little emotion, we feel flat and lose vitality for life. You learn to pause before acting. This gives you a chance to evaluate your feelings and impulses and the possible consequences of acting on them. Everything seems slower and calmer, so you make better decisions. We take in what another person is saying, their body signals, etc., and create an internal formation in our mind of what he or she is experiencing. This helps with connecting and closeness, and again, works both ways. You learn to see yourself and your life more objectively, stringing together events of your past and considering your possibilities for your future based on non-judgmental acceptance of your strengths and weaknesses, along with your potential for growth. Our fear alarm frequently gets set off unnecessarily. Each time it does, your mind and body are thrown off. Mindfulness reduces your overall states of fear and anxiety and also helps you react objectively when your alarm is set off. Your body does give you a great deal of information that helps to make decisions. However, most people have difficulty listening to what their body is telling them, especially when you've been, quote, living, close quote, in the negativity of your default neural network. Your body sensations become distorted and misinterpreted. Mindfulness practice trains your brain to be present in the moment and observe what is happening without the toxic judging. Morality is concerned about what is right and what is wrong. This relates to values, which are beliefs we have for or against something, in which we're emotionally invested. Morality and our values form a template or guide for our behaviors. Now we'll leave mindfulness behind for a while. I believe that mindfulness is a core skill, and from there everything else falls in place. The mindfulness helps the patient to be in the present and to get rid of the judging. From there it becomes far easier to learn the skills and to change their behaviors. Back to the bio, psycho, social, spiritual. Earlier you saw a list that broke down some of the wellness behaviors. This is more focused on skills. As you can see, under the biological section, there are nutrition skills, sleep hygiene skills, exercise skills, etc. Most of the time, we're not teaching all these skills, but it's important to know who we can refer to. Psychological skills are our forte, starting with mindfulness skills and going down to various cognitive skills, behavior change skills, and emotion skills. Many of these have worksheets or packets that we start with the patient and send them home with to work on. Most of our patients with depression have relationships that are problematic. There are skills that they can learn to listen, express themselves, and connect with others. As I mentioned earlier, spirituality is also an important sphere. There are skills to gain spiritual awareness, skills to resolve conflicts, and also skills to practice and develop their meditation practice, their curiosity and inquisitiveness, appreciation, and living a life of values. How do mindfulness and skills training go together? When we practice mindfulness, we're checking in as often as possible. What's that voice in my head saying to me? Which stream am I in? We try to step back from the voice in our head, our thoughts. We identify the insecurities and the judging. We look for a logical thought process and non-judging. We check out our emotions and our impulses, and what's our body saying to us? According to DBT and Marshall Linehan, we have the wise mind, and then we have the rational mind that's in quotes because it's not always rational, and we have our emotional mind. With mindfulness training, we learn to be present and non-judgmental. That's the master skill, number one. From there, we're checking in. What's happening now? What am I thinking? Are there any distortions? What am I feeling? Do my emotions fit the facts? And what are my goals and priorities? And what's the best action? The number 2 skill is CBT. Cognitive therapy is the part where we look at our thoughts and we identify the distortions and we neutralize them. Number 3 is learning to sort out our feelings. Most people who come to therapy do not know how to talk about their emotions. Within 1 or 2 sessions, they can learn how to label and identify what they're feeling. Anger versus frustration, anxiety versus fear, depression versus sadness, shame, pride, hurt. Once the patient can identify each feeling physically, it's a lot easier to go from there. They can learn how to tolerate emotional distress and crisis management. According to DBT, distress tolerance and crisis management are skills to do when you're emotionally dysregulated and overwhelmed. Emotion regulation has to do with more of the finer points of managing anger, sadness, guilt, etc. In addition to the cognitive skills and the emotion skills, it's important to learn about setting goals, determining values and priorities, and how to become more intentional and effective. I tell patients that when they first practice the mindfulness, they have to do it on an intentional basis as often as they possibly can, just like going in and practicing swimming laps in the pool. Over time, the more they do it, the mindfulness is going on more regularly in the background, kind of like the spell checker in the word processor on the computer, which is running in the background, and you don't see it until you make a mistake and it pops up. This is an overview of the way I see the skills, how I put them together so the patient can see the strategy. In our sessions, we jump around, and sometimes we'll work on cognitive therapy, and other times we'll work on emotion skills. This is the worksheet I use to help patients sort out emotions. It's separated into unhealthy emotions at the top and healthy emotions at the bottom. The right column is where they would jot down their thoughts, because this is mostly focused on the center column, which has to do with the physical sensations. We generally start with anxiety and what are the physical sensations in the body, and then down to depression. We save frustration for later, and then we go into the emotions on the bottom according to what the patient can bring up at the moment. I've also introduced this emotion regulation worksheet to help patients put together songs and even playlists, which can help them change their mood when necessary. I've put together what I call a mindfulness tune-up, which is something that can be trained and practiced and then utilized before stepping into situations where your full concentration and presence is required. I call these strings, as in the strings of a guitar which you tune up before you perform. I've organized these strings in relation to the clusters described above. So when the first string is tuned up in the brain, the patient goes from a state of fear into a state of feeling safe and loved and loving. Tuning up the second string would put the patient into the present. Tuning the third string helps to shift to left brain approach. Tuning the fourth string is to identify and recognize what the current emotions and impulses are and to work on calming those. The fifth string is to refocus on values and priorities. The sixth string is to become more firm in your boundaries about what's you and what's not you. Now a little bit about how exercise helps the brain. It's amazing what it does physically. By increasing synaptic plasticity, that means there's more growth of nerves and more synapses. There are direct effects in the synapse, but there are also indirect effects of exercise on the brain, because exercise supports underlying systems in the body that encourage neurogenesis, increase metabolism, and improve vascular function. Exercise has been shown to induce growth factors and growth factor cascades that increase the availability of the fertilizer for the brain and growth factor for the brain, as well as growth factor for blood vessels to the brain. We also know that exercise reduces the risk of brain diseases such as Alzheimer's. Exercise has been shown to have therapeutic effects on depression, and we know depression kills brain cells. Exercise leads to improvement in the hypothalamic pituitary adrenal axis that regulates the stress response. Exercise again works peripherally to reduce risk factors for diabetes, hypertension, and cardiovascular disease, which all have effects on the brain. Exercise reduces inflammation, and inflammation impairs growth factor signaling. And we also believe that inflammation may be involved in a lot more brain diseases than was once thought. Now up to the social area, relationships in the brain. There are studies that show the benefits of social connectedness, pessimism, and happiness. Scientific research on spirituality is also sparse. We know that there are benefits of spirituality, such as being aware of things bigger than us and seeing ourselves in a greater context. This tends to pull us outside of our default neural network and our self. When we help people to figure out their own worldview, we help them to move from a life of fear, of judgment and rejection, to a life of values and what's important to them.